client in ambulation. Ambulation is defined as moving a client from one place to another. It is to keep client more active, improve muscle tone and strength of the lower extremities, slow low bone mass and density related to osteoporosis. It also promotes peristalsis and circulation. The client get a sense of accomplishment and maintain greater independence. The equipment will be needing gait belt as necessary, non-skid shoes or slippers, non-sterile gloves, and other PPE as indicated, stand assistance device as necessary if available, additional staff for assistance as needed. First, we're going to review the medical record and nursing plan of care for conditions that may influence the client's ability to move and ambulate, assess the tubes, IV lines, incisions, or equipments that may alter the procedure for the ambulation, identify any movement limitations. Reviewing the medical records and plan of care validates the correct client and correct procedure. Checking for equipments and limits the reduce the risk for client's injury. Now we're going to perform hand hygiene, put on PPE as indicated. Hand hygiene and PPE prevents the spread of any microorganisms. PPE is required based on transmission precaution. May hapon, ma'am. So, ako si Mike Andreas Piquero, imong student nurse karon. So, sa'yo pangalan niyo, ma'am?
Wendy Gringo, sir.
So, kung saan birthday, ma'am?
January 27, 1985.
Check ako yung wristband, ma'am, ha? Nabatay ka ng feeling karon nga murag nalipong ta kanang kapoy atong lawas or kanang lisod tag paginawa, ma'am? Wala. Now we're going to identify the clients and explain the procedure to the client, asking the client to report any feeling of dizziness, weakness, or shortness of breath while walking. Decide how far to walk. This is also to validate the correct client and correct procedure. Discussing and explaining helps allay the anxiety and prepare the client for what to expect. Going to place the bed in a lower position. Proper bed height ensures safety when getting the client out of bed. Encourage the client to make use of a stand assisted aid, either freestanding or attached to the side of the bed, if available. To move the other side of the bed, assist the client to the side of the bed if necessary. Encourage independence, reduce strain for staff, and decrease the risk for client's injury. Have the client sit on the side of the bed for several minutes and assess for dizziness or lightheadedness. Have the client stay sitting until he or she feels secure. Having the client sit at the side of the bed minimize the risk for blood pressure changes or orthostatic hypotension that can occur with position change. Allowing the client to sit until he or she feels secure reduces anxiety and helps prevent injury. Now we're going to assist the client to put on a non-skid or slip-resistant footwear. Doing so ensures safety and client warmth. Now apply a gait belt snugly around the client's waist based on assessed need and facility policy. Gait belt improves the caregiver's grasp, reducing the risk of musculoskeletal injury to the staff and also to the client. The belt also provides firm grasp for the caregiver if the client should lose his or her balance. After that, we're going to assist the client by standing in front of the client, grasping each side of the gait belt, keeping back straight and knees bent. Use of gait belt will prevent injury to the nurse and also to the client. While holding the belt, gently rock back and forth 3 times. On the 3rd time, pull the client into a standing position. The action provides momentum to help the client in the standing position. Once the client is standing and feels stable, move to the unaffected side of the grasp the gait belt in the middle of the back. With the other hand, hold the client's hand closest to you. If the client does not require a gait belt, place the hand closest to the client around the upper arm and hold the client's hand with your other hand. Standing to the side of the client prevents provide assistance without blocking the client. Assess the client's balance and leg strength. If the client is weak or unsteady, sit client back down on or assist to a chair. Assessing balance and strength helps to identify readiness for ambulation. If the client feels stable, begin walking, matching your steps to the client's. Instruct the client to look ahead and lift each foot off the ground. Mobilize joint of the lower extremities, improve musculoskeletal coordination and muscle strength, and improve exercise performance. Take several steps forward with the client. Continue to assess the client's strength and balance. Remind the client to stand erect. Taking several steps with the client and standing erect promotes good balance and stability. Continued assessment helps maintain client safety. Continue with the ambulation for the planned distance and time. When the client is finished ambulating, return to the client to the bed or chair based on the client's tolerance and condition. If the client returns to bed, place the bed in a lower position, raise the side rails as required, and ensure call bell is within reach. Ambulation as prescribed promotes activity and prevents fatigue, allowing a client to rest after ambulation helps prevent fatigue. Remove gait belt, clean transfer aid per facility policy if not indicated for single client's use. We're going to remove the gloves and other PPE if used. Perform hand hygiene. Proper cleaning of equipments between client use prevent the spread of any microorganisms.
Ma'am, karon na matod kanang walk kanang nabatay na feel, nabatay na bati nga mga kuan na lipong nga sa ulo.
Wala.
Wala. So, kuan ma'am, so mura to siya, pwede na mag-rest if ever nga naa kay gusto nga kuan tawag na ratoy bell diri. Tapos kanang naamo ko lain matabang sa ma'am. Okay na ba ang tanan?
Okay na.
Salamat po.
Now, we're going to document the activity and other pertinent observation, the client's tolerance of the procedure, and the distance walked. Document the use of transfer aid and number of staff required for transfer. This provides a baseline of client's ability and promotes clear communication between healthcare providers. And that will be all. Thank you.